Today we have a patient of mine named Alanna Wong who suffers from a very rare sleep disorder called Kleine-Levin Syndrome. This is also referred to as Sleeping Beauty Syndrome. Alanna is going to tell us about her experience with this illness, and through this I'm hoping that we'll all have a better understanding of the neurobiology of sleep. Alanna, thank you for being here with us today.
Thank you. Thank you for having me.
So maybe you can just tell us, what does it feel like when you're having an episode of Kleine-Levin Syndrome, or when you're in the throes of this illness?
When I'm in an episode, it feels like I'm in a semi-conscious state. So when I appear to be awake during episodes, it's like I'm in a sleep state 24/7. So for instance, if my mom comes into my bedroom and asks, "What do you want for dinner?" I'm not sure if she's actually there or if I'm just dreaming it, if she's actually asking me what I want for dinner or if I'm just dreaming it. So it feels like I'm in a dream state during episodes. I'm very, very childlike. It's like almost two different brains. So when I'm sick, I'm not myself. I'm not the Alanna that I know. I'm not who I am today. I am a completely different person. So I act like a 2-year-old, 3-year-old. Sometimes I'll throw tantrums, and there's absolutely no control over KLS. There's just no choice in it, and it's very devastating. It's awful. My head feels like very foggy, and I feel like I'm in a dream during episodes. So I'm not sure if life is really happening or if I'm just dreaming that things are happening. So it's a very confusing state to be in.
Alanna, some people refer to this illness as Sleeping Beauty Syndrome. It comes out of the blue. It involves recurrent episodes of excessive sleepiness, behavior change, eating lots of food, that type of thing. When was your first episode, and how long are your episodes? What's the longest episode that you've ever had?
So I got KLS when I was 10 years old, and from 10 to 14, my episodes were very light and they didn't come very frequently. So I had more time in between episodes, and they would only last like 1 to 3 days long. And then they started lasting longer and longer as time went on. So from 10 to 14, my episodes were very light, and then at 15, my first major episode occurred. And that was a very difficult time because I was misdiagnosed and undiagnosed. And I was misdiagnosed with possible schizophrenia, possible manic depression. And from 15 to 21, my episodes got very, very severe. My symptoms were awful, and the frequency kept, occurring quite often. My episodes became longer, and they became, I didn't have as much health in between episodes. So I was very sick from 15 to 21, and my longest episode was 8 months long.
Wow.
On June 29th, 2009, I fell asleep, and I did not wake up until February 11th, 2010. And during that time, when I am sick, time does not exist. When I'm in an episode, it does not exist. So for instance, if I fall asleep on June 1st and wake up on June 30th, I will think that when I wake up from an episode, I will think that it's the day that I fell sick. So I'll think that June 1st was that time. So those 30 days did not exist.
So you're just losing huge chunks of your life
Yes.
as a result of this.
Yes.
So when you talk about the symptoms, then we're talking about that. We're talking about the excessive sleep. What other symptoms have been a part of this illness for you?
I experience a very ravenous appetite. So during episodes, I can eat enormous amounts of food. I can eat as many meals as 3 men would eat in one day. And it's very devastating because during episodes, you eat so much and you don't even remember. You have no memory of eating or of doing any kind of behaviors that you're experiencing. So when I wake up from episodes, sometimes I'll gain 5, 10, 15 pounds, and I'll have no memory of the foods that I've been eating. So that's a very devastating symptom. And then also I experience sometimes anger outbursts, and that is the hardest part of KLS because, I mean, you know, you have no memory, you don't know what you're doing during episodes. It's a completely physical illness, there's no choice. And there's times where I've lashed out at my parents and I have no memory of it. And when I wake up, I'm, you know, confused and disoriented, and I don't know what happened during episodes. And my parents, I'll remember bits and pieces, and my parents will tell me, oh, this is what happened. And it can be very, very devastating to a family.
What triggers have you noticed that kick you into an episode of this illness?
There have been many triggers. So what triggers episodes for me are alcohol, anesthetics, and flu-like symptoms. So any kind of cold or flu bugs, those are triggers for KLS. Alcohol is definitely a trigger, and anesthetics trigger KLS. So anesthetics, that is my main trigger for KLS episodes. And it's almost like if you've seen a YouTube video of a patient going into the dentist office and they get their wisdom teeth removed, they come out of the office sometimes very confused and disoriented, and they're unsure what happened, and they're just a completely different person. That's what it's like for KLS, but that can last days, weeks, and even months in that kind of state, in a very confused and disoriented state. So anesthetics are definitely a trigger of KLS.
So what kind of treatments have worked for you, and what's been the natural history of this disease for you? How is it going as you continue to deal with KLS?
Unfortunately, there are no treatments for KLS, and there's no known cure or cause. But I have tried a few medications that have been helpful. They have not cured me, but they have helped alleviate some symptoms that I've experienced. So when I was going through a very severe time during KLS from 15 to 21, that was the worst time of my KLS experience, and one of my doctors prescribed prazosin, and prazosin is used for veterans that experience post-traumatic stress disorder, and it helps with nightmares. So during KLS episodes, I experienced nightmares, and it's like a living nightmare. It's like you're living in hell during an episode. So the prazosin really helped with my nightmares, and they lessened. But eventually, once I started to get better, I got off of prazosin. But that did definitely help me calm me down. It's a blood pressure medication that lowers your blood pressure. So that helped tremendously during my very severe episodes, and it helps with hallucinations as well. Mm-hmm. And then I took Cytomel also, and Cytomel was very helpful too. Cytomel is T3 for your thyroid, and it helps with your energy. So for me, it helped with my energy and focus. I was able to get more energy, and I was able to focus more. I was able to go back to school and take a couple online courses and do a couple online programs, which was very helpful. So the Cytomel was definitely a big help, but eventually, once I got better, I got off of it. The negative about Cytomel is it is addictive. So when I stopped taking it, I kind of craved it, and my body started to need it because I wasn't producing energy, and I was only able to produce energy by taking the Cytomel. So I realized, okay, this isn't what I need. I want to produce my natural energy. But that was very helpful. And then also serotonin is another very, very helpful. That's what I'm on right now, the serotonin, and it helps calm me down, and I'm not as irritable on the medication, and I don't have as many worries. So it's definitely helped tremendously.
So fortunately for the majority of people that have this illness, as they get older, the episodes become shorter and shorter and less severe and less frequent. And ultimately, most people go on to outgrow this. Has that been your experience so far?
Yes, I have. Over the past couple years, I'm definitely getting better. KLS is improving for me, and I feel like KLS is weakening in me. I do feel like I'm outgrowing it. My episodes are much lighter. They're not very severe anymore, so my symptoms are to a much lesser degree of severity than previously in my previous years. So it's definitely getting better for me. I do feel like I'm outgrowing it. I'm getting longer stretches, but longer stretches in between episodes, but they do still come fairly frequent. So I think each KLS case is different. And sometimes, for me, my case, it came in lighter. The episodes came in lighter from 10 to 14, and I feel like it's reverting back into that. It's becoming lighter now again. And they might not necessarily be spreading apart, like, where I get a year in between episodes, but I do get months now of health.
So I'm interested to know, you have sleep when you're not in an episode, and then you have the apparent sleep that's occurring when you're in an episode. What's the difference between the sleep that you get when you're in one of these episodes and the sleep that you get when you're not in an episode?
The sleep episodes are completely different than when I am healthy and I fall asleep. When I'm healthy and I sleep, it's normal. I feel energized when I wake up in the morning, and I'm able to go about my daily activities. During episodes, my sleep is not normal at all. When I fall asleep, it's like when I fall asleep, it's like a nightmare state 24/7. And during it, when I wake up from episodes, during the episode, when I'm sleeping and I wake up, I'm not rested. I'm not fully rested. So it's, I gotta think for a minute.
It's like empty sleep.
Yes, it is.
It's not, doesn't seem to be providing the same restorative qualities as your sleep when you're not in an episode.
Yes, definitely.
So I think one thing that's important, and you've touched on this, is how long it can take for a person with Kleine-Levin Syndrome from symptom onset till diagnosis. Describe for us in a little more depth your journey that occurred. How long did that take, and what other diagnoses were you given along the way that were incorrect until you were diagnosed with Kleine-Levin Syndrome?
Yes. It takes on average 4 years for a KLS patient to get diagnosed, a proper diagnosis of KLS, and that is so devastating. During the undiagnosed years and the misdiagnosed years, that's the worst part of KLS, because families have, they go through suffering during the undiagnosed and misdiagnosed years, just unfair suffering. Their KLS families are misunderstood, mistreated. The medical community kind of assumes. They're not sure. Like when I went into hospitals when I was undiagnosed, doctors would assume that I was on drugs or that I was choosing this behavior, and it's not a choice. KLS is not a choice. So for me, I got KLS at 10, and I went undiagnosed for 8 years. So at 18, I finally found out that I had Kleine-Levin syndrome. And luckily, I had very supportive parents and a very supportive family, so they stuck by my side. But it's so devastating, because if you go undiagnosed for years and years, you're not going to get the right kind of care. And if you don't have a supportive family backing you, then you're going to be left behind, and you may end up in a place that is not where you're supposed to be, and you won't get the right proper treatment and the right kind of help. So I went undiagnosed for 8 years, and finally at 18 I found out that I had Kleine-Levin Syndrome. And from 15 to 21, my episodes were very, very severe. They were very constant and they were long, and my symptoms were so severe. I have so many blank days. I've probably lost, I'm 24 years old, and I've lost about 6 to 7 years of my life. So due to KLS. And the time that I lost doesn't exist. It doesn't exist in my memory. They're complete blanks. The episodes that I go through, I have no memory of them. It's a very, very difficult disorder for people to understand, for the community to grasp, and for people to, to understand it because of its nature. It's cyclical, so it comes and goes, and then you're healthy and you're sick. So it's like having two different brains, really. And I have taken brain scans that showed incredible results. One was taken when I was symptomatic, and one was taken when I was asymptomatic. So when I was sick, the brain scan showed that I had a 30% blood reduction going to the hypothalamus, thalamus region of the brain. And the thalamus controls all the basic human functions, sleep, eat, and sex. And those are all altered during KLS episodes. So they showed some incredible results. And then when I was healthy, my brain was perfectly normal, and there was no structural damage and no signs of anything wrong. So it's a very difficult disorder to have two brains and to lose all this time. And it does eventually go away, but for 1 to 2, sometimes even 3 decades of your life, it's a very difficult journey.
What do you have any message in particular that you'd like to convey to people that are suffering from this disorder?
Yes, I would like people to know that KLS is not a choice, that there is no choosing. KLS is a physical illness that affects the brain and nervous system, and it's completely organic. So there is no behavioral disorder. It's almost like a diabetic, and a diabetic, if they don't get insulin, then they will have different kind of behaviors. And if someone says to the diabetic, oh, just act normal and get healthy without giving them the insulin, they won't be able to do that. They need the insulin. And that's like a KLS patient. A KLS patient, it's completely organic and physical. So there's no choice, there's no behavioral issues. It's completely organic. And one thing I would like the KLS, I would like to tell the KLS community is, if you can just have one person that supports you and that is there for you, that makes all the difference in the world. Because having my mom and my dad that have been there right by my side has helped me tremendously, and I've been able to prosper and have a life that I'm happy in, that I've deserved. And so having a support system is huge in KLS.
Alanna, we have some video of you when you're in the middle of an episode, and I want you to watch it and then tell us all, how you feel and what you think when you see this.
I feel like I'm in a dream.
Hi, Alanna.
I feel like I'm in a dream.
Really?
Ew. I threw up 5 times.
You did?
Ew. I'm
What,
gonna make Mom a pretty picture.
a pretty picture? Really?
Yeah.
What of?
Flowers and trees and a heart.
How come you're gonna make Mommy a picture?
'Cause I want to.
Mm-hmm.
'Cause I want to. No! Are you getting tired? No! I think you're getting tired, honey.
Nobody likes me.
Oh, come here.
Mimi hates me.
She loves you.
She said she hates me.
She would never say that.
She did do say that.
Come here.
Nobody likes me.
It's just completely different. It's not even the same person.
How does it make you feel when you see this video of yourself when you're in one of your episodes?
It's hard because I don't remember that. Like it's so difficult because when I see me sick, it's not me. That's not who I am. This is who I am right now. I'm Alanna. I'm the real Alanna, and I'm healthy. And when I see that, it's sad. It's almost like seeing a different person. And it's not me. It's not the real Alanna. So it's like seeing someone else. And it's just awful because it is me, though. And it's something in my brain that that's a malfunction. And it's really hard to see videos when I'm sick. It makes me very sad because what my parents have had to go through, what I've had to go through, what other KLS families are going through, it's one of the worst illnesses anyone could ever imagine.
Alanna, what message do you have for the KLS community at large?
I would like to tell the KLS medical world that during some KLS episodes, patients are able to function during episodes. And that is very, very difficult on a KLS patient because some episodes you're in a semi-conscious state, but it's not like you're sleeping all the time. So during episodes, you can sleep anywhere from 12 to 22 hours a day. And in the time that you're awake, you're not really awake, and you can still function sometimes. Sometimes KLS kids are forced to go to school and forced to function in the world, which is awful because that's when things happen to KLS patients that are devastating and wrong. The KLS kids are misunderstood. When they're able to function during episodes, it's so difficult because you're misunderstood, you're judged, and you're not supposed to be functioning in an altered state. And I would like the KLS community to know that there are some episodes where KLS kids can function. So what's important for the KLS community to know is that these kids need to be at home where they're looked after 24/7. They have a caregiver 24/7 with them, and they don't leave the house. They're just in their bed, in their house, in a comfortable place, and where they can sleep as much as they want, and they aren't forced to function in society, because that's where things can go very, very wrong during episodes.
So a person's in a KLS episode, but it appears that they can function at a higher level than they actually can.
Yes.
And that's when problems really come to the forefront.
Exactly, yes. Mm-hmm.
Some people refer to this illness as Sleeping Beauty Syndrome. What do you think about that term to describe what you've gone through?
Well, during KLS episodes, it's definitely not a pretty illness. And Sleeping Beauty Syndrome sounds very peaceful and happy and pretty. And there's nothing peaceful about Kleine-Levin Syndrome. There's nothing pretty about Kleine-Levin Syndrome. KLS is a living nightmare. It's a living hell to be in a KLS episode and to live with KLS. So the name Sleeping Beauty Syndrome is definitely not it's not how I would describe KLS at all. Mm-hmm. Sleeping Beauty Syndrome sounds good, it sounds peaceful, and KLS is the complete opposite of Sleeping Beauty Syndrome. It's a devastating disorder. it's awful. It's a nightmare. It's a living nightmare.
Alanna, if somebody wanted to learn more about Kleine-Levin Syndrome, what kind of resources are out there that can help them understand this illness?
There are quite a few resources for Kleine-Levin Syndrome patients, and since I have experienced KLS and I went undiagnosed for 8 long, devastating years, I decided to create a website for KLS patients and people that are suffering from a neurological illness to go to get support and help and to feel hopeful. Because the one thing during my episodes, I always kept my dreams alive, and that's what kept me going. I needed the inspiration and the hope. So I created a website for people with Kleine-Levin syndrome and other people with neurological illnesses to go to get that support and the care that they crave when they're alone. My website is called www.alannawonglife.com. That's www.alannawonglife.com. And also a very major resource for Kleine-Levin syndrome patients is the KLS Foundation. And the KLS Foundation is a fantastic nonprofit organization. And right now we are researching on finding out the cause and cure of KLS. We're doing research at Stanford University. We are a very small nonprofit, and we have about 10 people on the board. I'm on the board of the KLS Foundation, and the website is www.klsfoundation.org. That is the main KLS research website to go to. And it's a great community, very supportive, and very opening and welcoming.
Great, thank you. That'll be very helpful for people.
Yes, yeah. The support is the #1 key in any kind of illness, especially KLS. Support is what people need when going through a very difficult and hard illness. We need the support, and we need to raise funds for research, and we need more awareness out there for Kleine-Levin syndrome so we can find the cause and cure. So these are great resources, klsfoundation.org and alannawonglife.com.
Thank you. That'll be very helpful for people.